Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words, and for some of them, the cause was never really their age. It was a bottle sitting on the bathroom shelf they were promised was safe. I'm Dr. Richard. After 15 years of practice, I've watched this exact picture play out more times than I can count. Someone who was sharp their whole life starts losing the thread, names, appointments, the drive home they've made 1,000 times, and everyone around them calls it getting old. It wasn't. It was a medication. One almost nobody thinks to question because a doctor prescribed it and a pharmacy filled it. Here is what the newer research keeps showing. One ordinary, everyday class of drug can pull your memory and your learning down hard inside a single year, and most people taking it have no idea it is happening. Today I am walking you through the 9 medications most closely tied to rapid memory loss, counted down from the ones that get quietly overlooked to the one I consider the most destructive of all. Watch for number 3. It is handed to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now without a single warning sign. Before we start, tell me in the comments how old you are and which medications you take every day. I read them, and the age of this audience shapes what I cover next. Let's start at number 9, and don't let the low spot on the list fool you, because this one is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine, sold over the counter as Benadryl. It is the little pink pill people reach for to fall asleep, to calm an allergy, or to take the edge off a cold. It costs a few dollars. It sits on an open shelf. And most people assume that because nobody needs a prescription for it, it must be gentle. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long word for a simple idea. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to lay down a new memory and to stay alert through the day. As we age, the brain makes less of it and leans harder on every bit it has left. So a drug that blocks it lands far heavier on a 70-year-old brain than a 30-year-old one. The part that takes the hit is the hippocampus, the small seahorse-shaped structure where new memories form before they get filed away for long-term storage. In my practice, I've watched patients take a nightly antihistamine for years and slowly lose their edge, never once connecting the fog to the pink pill by the bed. The research connects it plainly. A landmark 2015 study in JAMA Internal Medicine by Dr. Shelley Gray and colleagues followed more than 400 older adults for over a decade and found that people with the highest cumulative use of strong anticholinergics had a 54% higher risk of developing dementia than people who stayed off them. More than half again the normal risk from something most of us treat like candy. A separate 2019 nested case control study in BMJ by Coupland and colleagues, looking at nearly 60,000 patients in the UK, confirmed the same pattern at scale, with anticholinergic exposure linked to dementia diagnosis across multiple drug classes. Here's what to do. Read the label on anything you take to sleep, and anything marked PM, nighttime, or allergy relief, because those are very often just diphenhydramine wearing a different name. Common culprits include Tylenol PM, Advil PM, Unisum sleep gels, Zquil, and many sinus cold tablets. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, and cetirizine, sold as Zyrtec, that do not cross into the brain and are safer for the long haul. Never stop taking medication on your own. Bring it to your doctor, but stop assuming that over-the-counter means safe for your memory. That is number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is the proton pump inhibitors. The big names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in the stomach, and they get handed out for heartburn, reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring back. So it feels like the drug is the only thing holding the line. Here's the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients out of your food, and chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Turn the acid down far enough, long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those, and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutrient your medication has been blocking all along. In 2016, a large study in JAMA Neurology, led by Gom and Hainisch using German claims data, examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them, and the trouble runs deeper than nutrients, because PPIs have also been linked in experimental work to elevated levels of amyloid beta in animal models, the same sticky protein that builds up in human Alzheimer's disease. So here is the move. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers, like famotidine sold as Pepcid, which is far less likely to affect your thinking. Chewing deglycyrrhizonated licorice, a natural compound that coats and calms the stomach lining, can ease symptoms with no cost to the brain. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. Number 7 is prescribed for a problem most people would rather not talk about. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as Ditropan. It is given to seniors who deal with a sudden urgency to get to the bathroom, the kind of overactive bladder that can reshape a whole day. The relief is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the same memory chemical diphenhydramine blocks. And oxybutynin slips across into the brain very easily and parks itself right where memories are made. A 2024 evidence review in Urology by Chancellor and colleagues concluded that the body of evidence linking oxybutynin to cognitive impairment and incident dementia is now substantial enough to warrant caution in older adults. In the 2019 BMJ study by Coupland, anticholinergic drugs used for bladder control were among the strongest contributors to dementia risk in the cumulative exposure analysis, with effects rising sharply after a year or more of continuous use. Here is what troubles me most. Almost none of those patients were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation, and everyone around them nods and says, "Well, you're getting older." It is rarely traced back to the prescription until real ground has already been lost. If you take oxybutynin and you have noticed your memory slipping, take that seriously. You don't have to choose between your bladder and your brain. Newer medications like mirabegron, sold as Mirbatriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they provide similar control with far less risk to thinking. Bring it up at your next visit. Number 6. Statins. Number 6 might be the most surprising one here because it is also one of the most prescribed drug classes on Earth. Number 6 is the statins. Simvastatin, sold as Zocor, and atorvastatin, sold as Lipitor, are among the most prescribed medicines in the world, especially after age 60. And they do an important job, lowering cholesterol and reducing the risk of heart attacks and strokes. Statins belong in a lot of people's lives, and this is not a case against them. What follows is the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat and uses cholesterol to build the myelin sheath, the insulation wrapped around every nerve so signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs. The statins that cause the most trouble are the ones that cross easily into brain tissue, the lipophilic ones like simvastatin and atorvastatin. A review published in Frontiers in Aging Neuroscience in 2022 by Jamshidnejad Tosaramandani and colleagues called attention to modifying factors, including dose, duration, and individual blood-brain barrier permeability, that determine whether a given patient experiences cognitive effects. A 2024 narrative review in PMC indexed the broader mixed evidence. Meta-analytic data also suggest that each additional year of statin use is associated with about a 20% reduction in dementia risk in some populations, which means the picture is genuinely two-sided and dose-dependent rather than settled. So the takeaway is not that statins damage everyone. The takeaway is that dose, duration, and which statin you are on matter. Among statins, pravastatin and rosuvastatin cross less readily into the brain and are generally considered the safer picks when cognitive preservation is the priority. If you have been on a statin for years and you are noticing fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly stop a medication that may be protecting your heart. Get the plan right with professional guidance, never on your own. Quick pause. If this is helping connect the dots for you, take 1 second and tap that like button. It genuinely helps this information reach more seniors who need to hear it. And while you're down there, tell me how many prescriptions you are taking right now. I read every comment. Number 5 is the benzodiazepines. Lorazepam sold as Ativan, diazepam sold as Valium, alprazolam sold as Xanax. These are among the most commonly prescribed drugs in America for anxiety and for sleep problems. They work by boosting GABA, the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a rescue. The panic eases, the racing thoughts slow down, sleep finally comes. But over time, the picture begins to change. A 2014 study in BMJ by Degage and colleagues from Montreal followed nearly 9,000 older adults and reported that benzodiazepine use for 3 months or more was associated with a roughly 50% higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appeared to be more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain. What these medications do is create a slow chemical sedation of the entire brain. Learning becomes slower, mental flexibility decreases, and many people describe a sense of emotional flatness, as if they are moving through a fog and no longer feel entirely like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia often come back even harder, accompanied by agitation that can become genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the greatest harm. So here is the rule, and it matters. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly, because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually over weeks or even months. There are gentler alternatives. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. There are also specialized forms of talk therapy designed for insomnia and anxiety, particularly cognitive behavioral therapy, that can restore calm without the cognitive cost. Number 4, amitriptyline. Number 4 is a single medication prescribed for 3 different problems, and it carries one of the heaviest hidden burdens on this list. Number 4 is amitriptyline, sold as Elavil. It is an older tricyclic antidepressant that is still widely prescribed today for nerve pain, sleep difficulties, and migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can do everything, but beneath the surface, it is one of the most powerful anticholinergic drugs still in common use. That means it strongly blocks acetylcholine, the very chemical your neurons rely on to communicate with one another and to store new memories. The Gray 2015 JAMA Internal Medicine study identified amitriptyline class drugs as among the strongest contributors to anticholinergic dementia risk, with a 54% higher risk in the highest cumulative exposure group over a 10-year period. And almost none of those patients were ever told that the medication could do that. They were given it for sleep or for pain, then gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they simply assumed it was part of getting older. It does not even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs until the loss becomes significant. If you or someone you love takes amitriptyline, that is a conversation worth having soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as alternatives. And for mood disorders, newer antidepressants such as sertraline and escitalopram are generally considered much safer for the long-term health of the brain. Number 3, paroxetine. This is the one I told you to watch for, because it is prescribed to millions of people for something that sounds completely harmless. Number 3 is paroxetine, sold as Paxil. It is one of the most widely prescribed members of a family of antidepressants known as SSRIs, used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many older psychiatric medications. But here is the detail that is rarely discussed. Paroxetine is the one SSRI with strong anticholinergic activity. That single characteristic sets it apart from related medications such as sertraline and escitalopram, because it affects the same acetylcholine system that every other medication on this list has been disrupting. There is a painful irony in that finding. The medication is prescribed to help stabilize the mind, yet over time, it may erode the very clarity it was intended to protect. A 2016 study by Bali and colleagues in the American Journal of Alzheimer's Disease and Other Dementias found that paroxetine use among elderly patients with dementia and cognitive impairment carried a measurable risk signal compared with non-use. A 2023 pattern of use study in Frontiers in Psychiatry noted that paroxetine's anticholinergic profile continues to drive its inclusion on cautionary drug lists for seniors. The solution here is straightforward. In older adults, paroxetine is generally a medication worth avoiding when alternatives are available. The American Geriatric Society placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, and paroxetine appears there for precisely these cognitive reasons. If you take it, speak with your doctor about the possibility of switching to a safer SSRI, such as sertraline or escitalopram, both of which are gentler and do not carry the same concerns. Supporting healthy levels of B vitamins, especially B12 and B6, may also help support mood while you and your prescriber make any changes. Number 2 is prescribed so quietly that many people taking it do not even realize what type of medication it is. Number 2 is antipsychotic medication, and this one concerns me deeply because many individuals taking these drugs never knowingly agreed to take an antipsychotic. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, however, they are often prescribed off-label to older adults for sleep problems, mild restlessness, or agitation associated with dementia itself. Powerful medications designed for severe psychiatric illness are now frequently used in homes and nursing facilities for seniors who are simply confused, restless, or difficult for busy caregivers to manage. A 2021 study in the Journal of the American Medical Directors Association by Dyer and colleagues found that long-term antipsychotic use was associated with greater cognitive decline and dementia progression among community-dwelling older adults with mild to moderate Alzheimer's, even at relatively low doses. A larger 2022 analysis in Lancet Healthy Longevity, indexed in PMC, found that older adults given antipsychotics for behavioral symptoms experienced significantly faster cognitive decline within a year, even when they had no prior diagnosis of dementia. These medications can also increase the risk of stroke, pneumonia, sudden cardiac death, and the profound sedation that contributes to falls and hospitalizations. They work by suppressing dopamine, a chemical involved not only in mood regulation but also in focus, planning, and memory. Reduce dopamine enough, and the brain becomes slower and less responsive. That is why some individuals taking these medications can appear dull, emotionally flat, or almost absent, while their families grieve the gradual disappearance of someone who is still physically present. If you or a loved one is taking one of these medications, the first step is to ask the prescribing physician a direct question. Why was this medication started? And is it still necessary, or is it being used primarily for convenience? Many behavioral symptoms can be improved without medication at all, through consistent daily routines, reduced noise and overstimulation, treatment of hidden pain, and better management of sleep and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible duration helps reduce harm. Far too often, families are never informed about what these medications can do to the brain. They watch a decline they believe is simply aging, when the true cause may be chemical. Number 1. Anticholinergic polypharmacy. Now we arrive at number 1. It is not a single medication at all, and it may be the biggest hidden driver behind every story I have discussed today. Number 1 is anticholinergic polypharmacy. It is the danger almost nobody talks about, and it may be one of the leading causes of medication-induced memory loss in older adults. You were probably expecting one final villain, one single worst pill. The reality is more subtle. The greatest danger often comes from the slow accumulation of multiple anticholinergic medications taken together, while nobody calculates the total burden. Polypharmacy simply means taking many medications simultaneously. Anticholinergic burden refers to the combined effect of all of those medications, blocking the same memory-related chemical at the same time. Imagine a very common scenario. A senior takes diphenhydramine every night for sleep, oxybutynin every day for bladder control, and amitriptyline for nerve pain. Individually, each medication may produce only a small and barely noticeable effect. Together, however, those effects compound, and the burden on the brain rises rapidly. The Gray 2015 JAMA Internal Medicine study found that the risk climbed in step with cumulative anticholinergic exposure, and at the highest exposure band, the increased risk reached roughly 54% compared with non-users. More recent work, including a 2025 10-year follow-up study indexed in PMC, has continued to confirm the pattern in community populations. The overwhelming majority of older adults carrying that burden had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. When acetylcholine is blocked from several directions simultaneously, the brain does not simply slow down. Neurons can begin to weaken from underuse. Connections may shrink and the brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. Here is the hopeful part, and it is the reason I made this video. Medication-induced cognitive decline is often reversible when it is identified early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than many people realize, but only when the source of harm is removed. The solution does not require a miracle. It requires a careful medication review. Sit down with your doctor or pharmacist and review every prescription medication, every over-the-counter product, and every supplement you take. Add up the total anticholinergic burden. Simple, validated scoring tools, like the ACB scale from the Aging Brain program at Indiana University, are available to help identify that risk. Once the problematic medications are identified, unnecessary drugs can be reduced or discontinued under medical supervision. Safer alternatives can be introduced, and the brain can be given an opportunity to recover. This may be the single most preventable threat to the aging brain on this entire list, and that is exactly why it holds the #1 position. Now, I want to hear from you. Of these 9 medications, which ones are currently in your medicine cabinet? Have you noticed brain fog or increasing forgetfulness after starting a new medication? Tell me in the comments below, and tell me that you will ask for a medication review this week. Your answer might be the very thing that helps the next person who reads it. And before you go, there is one more place your body hides its warnings. Your medicine cabinet is one place. Your hands are another. Your fingernails can reveal warning signs involving your kidneys, your blood, and even your nervous system years before other symptoms appear. Most people never learn what to look for. That is the topic of the next video. I will show you the 4 nail signs worth checking tonight. I'm Dr. Richard. Stay sharp, and I will see you there.